3 tips for when you're tractioning an impacted canine. Watch the video. First of all, let's talk about preparing the anchorage. Check out the structure. I have a patient where, first, the space was opened with open coils, and before all that, a transpalatal bar or a transpalatal arch was placed. It can be either one. What's important is that the molars have anchorage to withstand the force coming from the cantilever. Okay? Next, let's move on to our second tip for successfully tractioning this impacted canine. The second tip is to work with a cantilever. So, this cantilever will be a TMA 0.17 by 0.25 cantilever. Once you have the cantilever in place, the first activation should be in the vertical direction. And why is that? We need clinical crown exposure in order to perform any kind of movement. After we have evidence that the tooth is coming into the mouth, we can do a second activation, which would be to move the tooth buccally. In other words, this cantilever isn't activated vertically. It's activated here to move this canine buccally. Then, once I have this canine in the mouth and I keep moving it more and more buccally, I can get my canines into position. So, those would be the 3 tips for how you can traction this canine. If you like this content and want to learn more about preventive and interceptive orthodontics to increase your number of patients and become a reference in your area, go ahead and follow my profile. I'll be with you as you build that knowledge.